Hey guys, so I'm gonna demonstrate today the placement of a modified Robert Jones bandage with a splint from a patient that has suffered wounds going through a fence. As you can see, the wounds have granulated quite nicely at this stage. I'm just adding some Manuka honey just to aid in formation of appropriate granulation tissue, so that's what we're doing here. The difficulty lies over this area with how much tension there is every time the dog flexes and extends the leg and the limb. So not only do we need to consider the wounds as a whole, we need to consider the biomechanics of the leg and the tension it allows with wound healing. So what we're going to do is I'm going to place some little absorbent tissues over the top. Given the stage of wound healing that we're in at this time, we don't want to take away from the healthy granulation bed, but we do want to help aid it in its healing moving forward. So these little bandages are going to aid to remove debris and other things like bacteria, so that it can form appropriate granulation tissue that will eventually lead to epithelialization and contraction and ultimately healing. So we've got a few different ways that we're going to go about this. So I'm just going to place that there. So the first step is I'm going to put some padding in between the toes. So the toes get quite sore from having bandages on. So I'm just going to place some padding interdigitally between each toe. This can be difficult sometimes, but just to get in there so that the little toes aren't getting sore from regular bandage placement. Okay, so just adding some little tissue, some padding in between those digits. And now what we're going to do is start placing a soft padded bandage over the top. So this is called soft band. So the soft band is going to aid in swelling, it's going to reduce compression, but ultimately it's going to hold our bandage nicely in place. Okay, so I'm just going to add this Allevion, which is an absorbent non-adhesive bandage, over the top of the area of concern. And we're just going to bandage that all the way up to here. And we're going to start working our way down. So we always start at the bottom, and the reason for that is that it pushes any swelling or edema up the limb rather than compressing it down, which can result in venous congestion and ultimately vascular problems with bandaging in itself. So we're going to make sure it's nicely bandaged. It's going to make it nice and comfortable for the patient. So I often add a fair amount of this soft bandaging. As I said, aids in compression of the swelling, aims to reduce that, but ultimately it is the primary layer in our support of bandaging this limb. So I'll add one more little layer, just another little one over the top. As I said, working my way from the bottom up when I start afresh. So that looks pretty good to me. I think that's a reasonable amount of padding. There we go. So the next layer we're going to utilize is what we call conforming bandage, and the conforming bandage in itself is there to similarly hold everything into place. We don't want to apply this too heavily, as this can cause constriction of the appropriate normal blood supply to the limb. So we want to apply it in a way that it just holds that soft padding into an appropriate position as we apply it to the limb. So I'll only put one layer worth, conforming bandage material worth of wrapping around the limb, because that's really all it needs. As I said, all it's doing there is just to hold everything kind of in place. And then I'll just tuck that away. There we go. As I spoke about, we're going to do a splint bandage on this patient. Now, the purpose of this splint bandage is to reduce the amount of motion that's occurring through that calcaneus. The difficulty lies that too much movement, too much flexion and extension through that calcaneus means that there's more tension that's being applied to this area, and too much tension means that it's not going to appropriately heal. So we need to provide an environment where that tissue is under very minimal tension in order to aid for it to heal. So I'm going to grab this conforming bandage again, and I'm just going to gently wrap this over the splint just to hold it into that position accordingly. So we know that we've got wounds on the medial aspect, so we're going to apply it to the lateral aspect of the limb. So just going around with the conforming bandage at this stage, just to try to hold everything into an appropriate position to prevent it from slipping or sliding or changing from the area that we ideally want it in. Okay, similarly, just going to tuck that in. Okay, so our next stage is what we call vet wrap, which is kind of our last sort of layering of the bandage. So similarly, going to start working my way from the bottom up. And we want about a 30 to 50% overlay of our application of this vet wrap. So you can see I'm placing it partly over the previous wrap, but not too far that you can see gaps between the vet wrap placement. So just working my way up to the point where our previous bandaging material has met, and we don't want to go above that. Ideally, what we want is that soft padded bandage to be, so from our first layer, that soft padded bandage to be what is last to be seen. Otherwise, we can cause constriction of our limb. So that's that. Now, what I do to aid in bandage application and to prevent it from slipping and sliding is I'll make a little wrap at the top, approximately 50% covering the bandage and 50% directly on the skin. And the aim of this is only really to help keep it into position. So this is a sticky elastoplast, and the purpose of that elastoplast simplistically is just to try and aid in holding it in an appropriate position. Okay, so that's all you need there. Just going to cut that off there. There we go. And lastly, what I do is I make a little stump for them to walk on. Now, it is important to keep the toes visible and easily accessible so that you can assess for any significant blood flow issues to the toes. So you can easily assess that just by cutting off this little corridor at the bottom of the bandage. But I found that patients often benefit from having a little stump placed so that they're able to walk not on their toes but on the bandage itself. So I'm just going to close that off there, cut it like that, and that should do. So we're going to get this patient back in about 5 to 7 days time to assess the integrity of those wounds and to assess how they're healing, but I'm quite happy with this application.